Thank you very much, Tom. Well, Dr. Marshall Allyn White is here now to talk about B12 deficiencies in the body and how they can cause some pretty serious health problems. Welcome, Dr. White.
Thank you.
Now let's talk about this. What causes a B12 deficiency, first off?
The primary issue is malabsorption of B12. B12 is a vitamin that's really critical to the repair of your central and peripheral nervous system. It's also essential in making blood cells. And so when you become deficient in B12, it causes problems with your central nervous system. People don't realize they're developing B12 because they don't know they've got this deficiency of a chemical that's made in your stomach called intrinsic factor. The B12 has to hook up with the intrinsic factor to be absorbed in your body, and there are many things that can cause a depletion of this intrinsic factor and subsequently a deficiency in B12. There's several medications on the market that are used for reflux, gastroesophageal reflux that people take that can deplete the stomach of B12. Excessive alcohol use can lead to B12 deficiency. So people estimate that maybe 15 to 40% of the population is deficient in B12. And we do a blood test to check for B12 in symptomatic patients if the physician recognizes that that the symptoms could be related to B12.
And let's talk about the symptoms.
Symptoms include fatigue, change in mood, typically depression or anxiety, and then numbness and tingling in the hands and feet. Those are the symptoms of early B12 deficiency, and if it's left untreated, it can actually lead to spinal cord disease where you can't walk properly, and it can lead to dementia later in life. In fact, B12 deficiency is one of the major causes of reversible dementia in elderly patients. Those of us over the age of 50, see, I'm confessing here.
I'm not far behind you, but go ahead.
develop B12 deficiency at a much higher rate. As you get older, the atrophy of the stomach lining occurs, and you don't make the intrinsic factor, so you're at much higher risk for B12 deficiency if you're older.
Now, why do you think it's under-recognized as a health problem?
I think we don't train people to look for it. It's one of the things that I've learned through my 25 years of private practice to always look for.
Now, what do some patients, potential patients, dismiss it as when they're having some of these symptoms, depression, you say, mood swings, and things like that? What are they misinterpreting at?
Most of the time they've been to their family physician. The family physician may not know what's going on if they don't check a B12 level or recognize the symptoms, because the symptoms are vague. Vague numbness in your hands and feet. They may look for neuropathy or other conditions and just miss the B12 deficiency. I think a B12 level needs to be high up on the list of blood tests run by physicians, particularly if you're having fatigue, if you're having difficulty concentrating, if you're having mood disturbance, if you're having numbness and tingling. Those are all early symptoms of B12 deficiency.
And actually, I think too, just some things that people might dismiss as, overworked, that you're overworked and you're just tired.
Sure, that's exactly right. People come in with B12 deficiency, and that's a cardinal complaint. It's important to receive injections.
I was going to talk about what are some ways where you can get the B12 that you need.
Well, you've got ample B12 in your diet in most cases. It comes from meat principally, and if you don't have the intrinsic factor, you can't absorb it. So it has to be given by way of intramuscular injection, and that's key. Once you've got a B12 deficiency, you're probably always going to have it. Don't let somebody run a B12 level if you're deficient and tell you it's normal, and then they stop supplementation, because it's like a leaky bucket. It's just going to leave your body and you'll become deficient again. So it's critical to remain vigilant and to be supplemented for your entire life.
All right. Well, Dr. White, thank you so much. Some great information there. So if you experience any of those symptoms that we were talking about earlier, please give Dr. White a call. And the telephone number off the top of your head? Do you know?
Off the top of my head.
Look at it. There it is. Look, off the top of the screen.
216-7311. I've got a lot of phone numbers.
There you go. And drmwhite.com. Thank you so much, Dr. White, for joining us.
Thanks, Tess.
All right. Take care. Much more Low Country Live coming up after the break.